All right, so we're going to get started. Very special welcome to everybody who's tuning in on tonight's webinar. We have a great webinar for you tonight. And uh, as with all of our webinars, please know that we're going to do a little bit of a Q&A at the end. So if you have any questions, just jot them down or type them in, and then we'll try to get to all those questions at the end. Every webinar is recorded, so if you have to step out or if you want to catch any of our past webinars, you can check out every webinar on our YouTube channel, which is www.youtube.com/EBFA Fitness. So, want to get started right away because we have a lot of information to go through with this webinar. Tonight, we have a very special guest educator. We have Dr. Emily Kiberd, who is a chiropractor. She's the founder of Urban Wellness Clinic here in New York City. She's an SFMA practitioner, NKT, and a yoga specialist. So, a very special welcome to Dr. Kiberd. Welcome, Emily.
Hi, Em. Thank you so much for having me.
Okay, so what I'm going to do is I'm going to
Um, it,
pass the floor to you, and then at the end, we'll do the questions.
okay, great. It's so great to share this knowledge with an audience that is movement specialist, that's familiar with your stuff and is really familiar with stuff from the ground up. So the practice of yoga, I just want to make a point, is there's a physical, there's a mental, there's a spiritual aspect to it. Um, And we're going to focus on the physical aspect, specifically from a place of good alignment, um, to retrain the body. So if you can go to the next slide. So we're going to focus on good alignment. We're going to try and balance any asymmetries. We're going to try and retrain our motor control through the use of the yoga practice. And I just wanted to start a little bit on kind of my evolution and how I got into this. So I started in chiropractic school. I was always interested in how the movement of the body and how it would compensate for another. In my experience, just being an athletic teenager, having an ankle sprain, a month later, starting to get headaches and just compensation patterns up through the kinetic chain. So that was usually that kind of spurred my interest in how the body moved. I next started getting into active release technique, which is like a really amazing soft tissue technique to break up scar tissue and adhesions. And then, with recommendation from a friend, I met David, and he's a founder of NKT, which is a muscle testing technique to help find compensation patterns. So when something is tight, right, most people think, oh, we need to release that tight area, right? So this technique helps, along with SFMA, finding whether something is a stability problem or a mobility problem, and then trying to correct that compensation pattern. Right now I'm playing with a little bit of SFMA stuff, trying to assess to see where there's more of a mobility versus a stability issue, and then retraining that motor control. And then my yoga influences, which happened back in chiropractic college, was John Friend, who's was the founder of Anusara Yoga, and then all these teachers, Christina Sell, Noah Maze, Elena, these are all have this base of Anusara Yoga, which is a very alignment-based yoga, in their background and in their training. That's how I was trained. So I think it's a good baseline in terms of building a yoga practice with alignment cues. Um, so we're going to start with the placement of the feet, and there's a lot of debate around this. Most yoga practitioners usually try to drive the feet into a parallel stance, and sometimes a hip width and parallel stance, and sometimes a feet together, inner edge touching. So I like to teach four corners of the feet, and this is from an Anusara base, where first you're rooting down the big toe mound, right? You can place your attention there, and then you're placing your attention on the outer edge of your foot. So as if you draw a line, just like in that diagram, and then that inner mound of your heel, and then to the pinky toe mound. So there's this 4 stable points in the foot placement. If I find someone is really, really turned out, I try to bring them back to more of a parallel stance. When we say parallel, it is if you take like that webbing between the second and the third toe and draw a line up to the middle of the ankle and then up to the kneecap. And obviously we're not all built the same way. So people who are having trouble getting into that position, it's okay for them to be turned out a little bit, maybe 10, 20 degrees, as long as their knees are starting to track over their toes. And then through these actions that we're going to go through, you can start to work some of the isometric contractions to start to help the body find that position. So from the ground, from the feet up. And a lot of the yoga practice, most people think, oh, we're creating shapes and we're creating poses. And it's really through these alignment cues, it's more than that. It's about creating actions through the musculature, balance actions, isometric contractions. So first, I always start with creating a foundation and an awareness through the feet. Next, we start to build an engagement, right? So oftentimes when people are practicing yoga, they think of one big opening, one big stretch, right? And there's this very important component of creating an active engagement to help protect the joints. In Anusara Yoga, we call this muscular energy. And there's a couple parts to it. So you picture as if you are hugging in, so as if you're like taking your muscles circumferentially and hugging it to the bone, right? So there's just drawing in towards the midline, so towards the center, drawing peripherally towards the core, and creating this hugging, this isometric contraction, hugging the muscles to the bones. So then the next step is to, and we can go to the next slide, to create a spiraling effect. And there's 2 spirals. One is going to start inner and spiraling from the inner edge of the foot up the leg. It's going to end up in the waistline. And I like to start that spiral from the first MP joint, and as if you're drawing it back through that inner arch and then drawing it up the leg. So you're spiraling inward. So it's going to create, if you draw it from the front of the foot back, it almost is like a mini short foot exercise through that inner edge of the foot. And as you start to go up the leg, it's going to internally rotate the leg all the way up into the waistline. Right. So at the top of the waistline, if you start to increase this spiraling effect of the leg, you're going to get an anterior pelvic tilt, a little bit of an increased lordosis. So if you see people walking around kind of butt clenched forward, pelvis thrusted forward, hips thrusted forward, hunched over, this is a really good way to start to access what would be the beginning of a neutral pelvis, like first starting to get that anterior pelvic tilt. And just one thing about these alignment cues is they are layered upon each other. So you start the foundation, you create the engagement, you keep the engagement, right? So you don't lose it as you start to create a spiraling action. So this is an inner spiral. The next one is an outer spiral. So the inner spiral starts from the foot, goes up the leg. The outer spiral is the opposite action. So it starts at the waistline and wraps down the leg. And you think about it as if you're like wrapping your outer hips and your outer seat down and back, right? So you might, almost as if you're doing the second half of finding neutral pelvis, which is tucking the pelvis under posterior pelvic tilt. Goes down the foot, all the way to the outer edge of the foot. As you do that, you can almost compare it to like a dialing of the foot into the floor to help create a stabilization. You can go to the next slide. So when you do these 2 spirals together, this inner and then this outer, there's this balanced action, right? So you help find a neutral pelvis. As you start to tuck your tailbone under, which is more of an outer spiral, you'll find a slight engagement of your abs, of your core, transverse abdominis. And it starts to help balance any asymmetries. So, someone who's extremely, extremely sway back, they're going to start to need to wrap more outer spiral, more like wrapping down of the glutes, more tuck of the pelvis, lengthening of the tailbone. Um, Someone maybe who's like more tight in the hips, or their hips are thrusted forward, they're going to need more spiraling of the inner spiral. So the idea when you're using these cues in this system is to find balanced action. Okay, so then the last cue is this element of extension. In Anusara Yoga, they call it organic energy. So you've had all these principles lined upon each other, almost as if they're layered. And so this last extension is an extension from the core outward to the periphery. And it's not only from the core down the legs, it's also a lateral expansion of front to back, and actually like this 3D lengthening. And there's this grounding quality that you feel through the feet when you do this. So these are kind of like the five, they call them the universal principles of alignment, but these are really good baseline and groundwork. So this is a video of my massage therapist. This is Bethany. We sometimes play with some yoga poses in the office. So if you play the video, so each person's going to need something different. So she's kind of dumping in her shoulders. So I'm giving her a cue: root your hands down, lift your shoulders up, and start to engage your shoulders down. Right. So you can see from the beginning she had a little bit of like a hard time finding that curve in her low back. So I have her bend her knees, I have her hug in, right? And I have her start to anterior pelvic tilt. And when she does that, she drops those lower ribs, right? So I say, wrap those lower ribs, like soften them down. Good. Keep all that. And as you start to straighten your legs, so she's driving her inner thighs back, she starts to wrap her glutes and root down through the heels. And right at the end there, there's this like lengthening and expansion. So if you go to the next slide, you can compare her start. We took her through all those alignment cues, and she's in a much more integrated pose, right? And you're going to have to give different cues to different body types. So Bethany here, she's like mobile shoulders. If you look at her low back, she's a little bit of a hard time finding that lordosis. She likes to crank it right between her shoulder blades. She has a history of difficulty finding her core strength, some neck problems, and so we take her through those alignment cues, building first the foundation, the hugging in. She bends her knees. That helps give a little more space to her hamstrings. Then we give that cue to start to like stick her seat back and wide. So that's one component of that inner spiraling that when we were just taking this video, I saw that she needed more of. Right? And then keeping that, and then starting to wrap her glutes down, creating the outer spiral all the way down her legs, and then reaching long, so pushing down through her hands and then down long through her feet. So if you look from the first picture, the back, she has a more integrated pose, not only the shoulders, the low back, her core is zipped in and engaged, and she's starting to get like the full length, the full benefit of the pose, downward facing dog. This is a really common thing that you'll see when you teach. So other common misalignments is someone will take too short of a stance. This is one of my friends, Emily. She's a yoga teacher up in Westchester. And so this pose on the right, you really want to have the knee stacked over the ankle. So I often give the cue to step the back foot back till you can have your knee stacked right over your ankle. The front foot, you can give a cue to line up the front heel, draw a line towards your back arch. The other cue I give here is to, most times, or oftentimes, people will start to kind of waver their knee. The knee will start to go inward. So I have them wrap their knee out and have it lined up between the second and third toe. So that's just a foundational cue. The next one you can kind of see from the back here is people will start to drive that back hip forward and kind of hang out in the pose. You can kind of see maybe she has a little bit of like a sway in her back. People start to like ride on their facets to help find stability because they haven't found that engagement. So here, if you look on the picture on the left, like her Her alignment's good, right? You draw a line from that front heel to her back arch, but she needs to find some sort of stability. So we give her a cue to hug in, maybe draw energy from her feet all the way up to her pelvis. Maybe tell her to hug her muscle to her bone. So trying to find that strength and stability through the legs, right? So we also give her a cue, and this is just a cueing of what we see, that back inner thigh is just like diving forward. So we want to start to create that effect of an inner spiral, right? So from the foot going up the leg, spiraling in, starting to take that inner thigh back and wide, right? And it's going to start to like settle that front hip back. So first we create engagement, spiraling, and then the last bit of it, and this is common in standing poses, is the back leg will need more of a spiraling inward, and then the front leg, to try and track that knee over the second and third toe, will need more of a spiraling outward. So that wrapping the glute under, spiraling that all the way down to the foot. And then you do this, so back legs going more in, front legs wrapping more under and out. There's more activation of your external rotation of your glute. You can create this balanced action in a standing pose. So, okay, so here, a really common way. So this is Trikonasana. This is triangle pose. So in a more traditional stance, or in a more traditional class, they will teach to start in a standing position, reach, so as if his torso would be upright, to reach that front arm forward, push the hips back, and to picture as if you're between two panes of glass and then touch the floor. And usually if you taught that pose that way, you would probably hear half the class a little clunk in their hip, maybe a little clunk through their hamstring. Here you can see he's having trouble finding his foundation in his front foot, like his big toe, his MP joint's coming off. So we're going to give that cue to ground that down, help him find the four corners of his feet, have even weight distribution, right? And if he still is having problem getting towards the floor, give him a block as a prop, also sensory afferent information through the hand to help find a little bit of core engagement. So going back to that like traditional teaching of between two panes of glass, I like to start it from the floor. So I like to start him, instead of standing and reaching forward, I like to start him with the block underneath his hand to prop him up, and then working through all those principles. So finding his foundation, finding his strength through his legs, finding a neutral pelvis, so an inner spiral balanced with an outer spiral here, and then that expansive energy, so organic energy pushing down through the feet, right? You can push down through the block. So instead of hanging out in space, which he looks like he's doing on the photo on the left, he's pushing and like activating, helping activate elements of his core by pushing down into that block and creating that expansive energy. Sometimes I give that cue to picture like you're ripping the mat in half between your 2 feet. Again, a common misalignment when you have tension in the hamstrings, which he always complains he does. So we'll give the cue to bend your knees, start to stick your seat or sit bones towards the sky, like widen your inner thighs back and wide, and try and help him find that anterior pelvic tilt to increase that lumbar lordosis. And for him, when he starts to straighten his legs, he loses that. So we can just keep him right at that with knees bent. That's an okay modification. You can even see like less tension through the back, maintaining stability through the shoulders. So this is a good cue for lunge poses. Oftentimes you'll see like super flexible people crank it through their low back, maybe even in their TL junction or lumbosacral junction, one of those transitional points, and then they'll come out of yoga class with low back pain, and that's really the last thing you want. You want people to come out feeling better than when they first started. So here we'll give her the cue to hug her legs in, keep her back leg straight, that back inner thighs lifted, and then to balance all that by starting to tuck her tailbone, like reaching it down towards the floor until she feels a little fire in her low belly. So there's this engagement of the core. It's almost as if she's finding like the actions of a neutral pelvis, but in a pose that's asymmetrical. Um, and then from there, she can start to reach down to the feet and up to the fingertips. So that's one. That's an element of spiraling outward. We can go to the next one. Okay, so that was common cues, common misalignments you see. And so how do you take that into like a functional rehab program? And in yoga and in any functional movement program, that's like FMS or an SFMA based uh, rehab program, it's always starts with the breath. So the box on the right is actually a video. It's like a 3D animation of diaphragmatic breathing. Let me just take a look at that. And so this the importance of diaphragmatic breathing. So there was a case study done 2009 where they took patients with chronic low back pain and they um, measured their breathing through different functional movements. So one was an active straight leg raise, one was bent knee, both feet on the table with a bent knee. You just have it fall out. It's considered a core rehabilitation. And in the study, they found that patients with chronic low back pain had a lack of diaphragmatic breathing. Whether it was in a rest position or if you started to bring functional movement into their body, the diaphragmatic breathing didn't return or increase. So let's go to the next slide. Here's another study by Kolar in 2009 where they took low back pain subjects through just normal breathing at rest. They did it laying down, supine, and then seated in a relaxed position. And then also during isometric contraction of the extremities. And they did it under a dynamic MRI. So you can go to the next slide. So when they did this, they found that the low back pain group demonstrated a higher incidence of a limited diaphragmatic activation during inspiration and an asymmetrical slope of the diaphragm. And that was found in the low back pain group. You can go to the next slide. Right, and then they also found in the low back pain group that muscles involved in respiration were recruited more than the diaphragm during breathing when there was that isometric contraction of the extremities. So what is this? What is this study saying? It's saying that people with low back pain have a hard time finding that diaphragmatic excursion, whether at rest or through resistance. And so what's I? So typically when I teach it as if you're like breathing on a pane of glass, like as if you're a little kid and you're breathing and fogging up a window. Right, so there's this contraction in the back of the throat. Some people describe it as like the sound of the ocean or Darth Vader breath. So there's contraction in the back of the throat with an exhale as well as an inhale. And you do it with the mouth closed, so it's in and out through the nose. Right, and then on the inhale, there's this diaphragmatic expansion through the belly, anterior to posterior, and then a lateral expansion. People are having a hard time accessing diaphragmatic breathing, especially into that lateral component. I'll have people place their tongue on the roof of their mouth and create a suction, like almost like a suckling response. And when you keep the jaw soft, you breathe in and out through the nose. Um, there's it helps you access that diaphragmatic breathing, especially that lateral component. So we can go to the next slide. Okay, so this is drawn from SFMA, and I've been incorporating this into the way I sequence my poses. So when you stand, you're starting to do dynamic movement, whether it's weight training or through a yoga sequence. It's a lot easier. There's a lot of more joints. There's a lot more places to find compensation, right? So if you take the poses through a neural developmental progression, right, and that progression is first we learn to breathe, to grip, to lift our head, right? This is the neural developmental, like when we're babies and we're learning these patterns to functionally move, right? Then we move our limbs, and then we learn to roll. Then we come onto hands and knees, kneeling, half kneeling, standing, and then single leg activity. So, from a trainer perspective, you take someone standing, they're doing cable pulls to do core work through their obliques. There's a lot more places to cheat or compensate, whether it's with the breath, with the musculature, with their alignment, than it would be if you took them through a rolling pattern. So if someone can't do a rolling pattern correctly on the floor, they're not ready to do it standing. So I've been trying to sequence my yoga classes in this way. So we can go to the next slide. Yep. So it's a photo of like as this neurodevelopmental patterning and progression. Okay, so here's an example of something that I would give using yoga in a functional movement rehabilitation program. So first, starting on the back, activating the core. So here I'm having him press his arms down, doing a variation of like a dead bug, right? Bring the knees together, starting to bring the core into like a rotational pattern, so a lower rolling pattern. And then that next neurodevelopmental after the rolling would be starting to be able to lift the head coming onto hands and knees. All right, so starting to access cobra. And then here, you can see Emily, we tell her, activate your toes down, press them into the floor, tuck your tailbone, pull your hands back towards your feet as if you were pulling your chest through. So in cobra here, oftentimes you'll see people ears riding up towards their shoulders, up towards their ears. So here we try and get their lats wrapping down, pulling their chest through. And then we progress them to a cat-cow so that they're finding their core, finding their stability on hands and knees. Maybe we'll start to do some rotational stuff, reaching high to the sky, trying to find a rotation through the thoracic and the lumbar spine, and then reaching under. We can go to the next slide. Okay, so the next progression, hands and knees, would be a half kneeling. So in this one on the right, we're actually having M do an iliacus stretch, one of the hip stretches, and then we're starting to have her take it through a rotational movement. You can keep the feet wide, hip width, that creates more stability. If you want them to try and challenge their core stability more, and this is from FMS, you can have them step their foot, front foot, so it's right in front of their back knee. So it's going to narrow their stance and have them try and find their core. And then starting to take a rotational movement through it to challenge it dynamically. Right, so the next progression would be to standing. Here, she's coming into Utkatasana chair pose, and we're giving her that block. So we're going to have her squeeze into the block. So it's going to activate adductors, but it's also going to start to help her find core engagement. Sometimes I'll even start to not using the block. So if we just have chair pose without the block, doing a chair pose, lifting one knee, chair pose, lifting the other knee. So starting to create like a cross crawl, like opposite arm, opposite foot progression that we need, that motor control to our brain. Then we start to do more dynamic poses. So warrior two, a lunge, standing forward bend, trying to keep the core engaged. Using blocks to press down into the floor versus just kind of hanging on the ligaments and the hamstrings and all the musculature of the back. So finding that dynamic stability into the core through the afferent information in the hands. Okay, so let's see the next slide. Great. And then we start to transition to one-legged poses. So here, warrior three with blocks, right? So if someone can find that stability, so all four corners of the feet rooted down, leg is straight, back inner thighs lifted high to the sky. Usually this is a advanced pose. It's hard to find this, right? Then they can start to transition to lifting their arms off the blocks. So here, I like to do coupled movements or movements that are going to functionally support each other. So maybe I'll have her come warrior three, back down to a lunge, twisting, having her come into plank to do the opposite side, then standing up, grabbing the knee. So a lot of like opposite patterns, the opposite upper body connected to the opposite lower body. Let's see the next slide. Okay, so here is, this is a case study. So here's someone who complains of tight calves, tight hamstrings, right? And so from a yogic perspective, where oftentimes, whatever's tight needs to get stretched. That's the common thought. Um, so trying to expand that view, okay, is it a mobility issue? Does he actually physically have adhesions and tightness in his, the back posterior chain, so calves, maybe the bottoms of the feet, hamstrings, or is it a stability issue? As his hamstrings uh, tight and clamping down because there's instability somewhere else, right? So here, we don't want him to hang off the musculature and the connective tissue in his back. We're going to put blocks underneath him. Maybe we'll give him some bend in the knees. So then we start to check if it's a motor control or stability issue. So here, I just have him do an active straight leg raise. And he's at like, I don't know, 65, 70 degrees. So I come in and I bring it, we do a passive straight leg raise. And he increases in the angle and the ability to lift his leg from a passive straight leg raise. So then we take his core, so I'm having him chop his arms down into my hand. I'm doing an active straight leg raise again. So we're doing an active straight leg raise with an integration of him activating his core. You can see, and it's subtle, it's probably like maybe 10 degrees. He can reach his leg higher. So here we get him to do his core work. So we haven't even really like stretched his hamstrings. We just get him to do some dead bugs. And we retest after, and without doing anything to his hamstring, like no stretching, he can start to bring his leg higher. So here we have this case where this assumption, oh, he can't touch his toes, he has tight hamstrings. Is it physically tight because there's adhesions? Is there joint restriction? No, it's because there's a lack of core stability. So once we start to turn on his core, and I'll often do this in yoga, I'll have everyone touch their toes, see where you're at, take note. We lay down, we start to do some core work, and then we recheck, and people are amazed, right? So here is a case where it's a stability issue, a lack of that integration of core to other parts of the body. Okay, so let's go to the next one. Okay, so how do we correct that? So we want to give a corrective and then an integration. So here is Supta Padangusthasana. This is a hamstring stretch. So on the left, it's like stretch with a strap, right? Like, so I like to integrate it. So he has tight hamstrings and he has core instability, or lack of firing of the core. So here we're going to do Supta Padangusthasana with a little bit of a crunch. So there's a stretch of the hamstring and a crunch in, right? So alternating legs. So I like to create those. It's almost like two yoga moves integrated into one. All right, let's see the next one. Again, here, just giving a little bit of a history, part of the case study. Soccer player, high arches, goes to take a penalty kick, tears rec fem off his at the origin. So as he's winding up, trying to get, trying to put away a goal, tears the muscle, feels a pop, tears the muscle off the bone. And when we go, we check him, complaints of posterior chain tightness. We go in, and this is from an NKT perspective, we go and check, okay, what is not stabilizing, causing posterior chain to grab and hold. We find that glutes inhibited, right? So the corrective that I would give would be like a downward facing dog, stretching that posterior line and starting to activate his glute. So here we can do it with a bridge. You can even see in his core, especially those bilateral external obliques. So we give him a corrective. This is a Cook bridge, is a single leg bridge, working each glute individually. And then we come in and then we integrate it with, and I have here just like pushing down into his heel, down through the hip. So he's having to find that stability. It creates a little bit of instability. So he's trying to find that stability even more so. So glute, core, he even got like shoulder stabilization going on here. So this full integration of a movement through the yoga pose. Let's see the next slide. Oh, and that's it. So kind of went through a technique of how to give, how to build the pose from the ground up with good alignment, common misalignments and cues to give, because obviously different body structures are going to need different aspects of the principles. And then, really knowing, is it a motor control issue? Is it a mobility issue? Is it a stability issue? And then starting to integrate that into a functional program where you're combining yoga poses, you're dynamically building from the ground all the way up to standing poses. Yeah.
Okay.
So if anyone has any questions, they can always email me. It's emily@urbanwellnessclinic.com. My clinic's at 57th and 6th in the city, right near Central Park.
Okay, great. Thank you so much, Emily. If anyone has
Welcome.
any questions, they can type it in, and then we'll go through a few questions with Emily while she is here without having to email her. I have a question while people are kind of thinking of some other questions. Is when you have somebody with a flat
Sure.
foot, so now they're starting to get kind of a break in their foundation, do you then,
Yes.
and you probably cue the foundation as far as the 4 points or like the foot tripod, do you have them actively
Mm-hmm.
do a short foot or any sort of intentional foot engagement?
Yeah, I will. So that so after they find their foundation and we find a muscular energy, I'll have them start to, and this is part of like that inner spiral, I'll start to have them draw from their first MP joint back towards that inner heel, right? So as if you're drawing a line, like as if you're doing a short foot exercise, and then you start to continue that spiraling up the leg all the way back to like an anterior pelvic tilt. So that very first part of like an inner spiral is actually like a mini short foot exercise. So yeah, I would
Oh,
definitely start to do that. Yeah.
excellent. All right, so let's see if there's some questions. All right, so any advice for yoga sequencing for facilitated or inhibited pelvic floor? That's a really good question.
Um, for a facilitated or a inhibited pelvic floor. So there's a couple aspects in breaking down in that they call them the universal principles. Um, Muscular engagement, so just in the mind creating a drawing up from the feet all the way up into the pelvis, almost creating that like lock of that bandha, so engaging the pelvic floor. That's one way to create an engagement. So you can do it at any pose. It's not so much like what pose do I use to create pelvic, you know, like how to activate and inhibit pelvic floor. You can give a cue. So part of that is muscular engagement. So drawing from the feet, from the periphery, all the way up into the core is going to create an engagement of the pelvic floor. The other one is an element of outer spiral. So if you're starting to lengthen your tailbone down. So if you're narrowing your tailbone towards your pubic bone, then wrapping your glutes, that can start to engage an inhibited pelvic floor. For a facilitated pelvic floor, you don't want to be over engaging the pelvic floor, right? You actually want to start to send a release to the pelvic floor, and that would be, and this is from NKT, from an anti-Kegel, where you're laying on your back and you lift your knees and you give resistance into the knees with the hands. So you're doing like an isometric contraction, kind of like rocking the knees um, towards the hands with the person supine and their knees bent. So you're doing an anti-Kegel. But the second part of that is, if let's say um, pelvic floor is facilitated and you want to release it with an anti-Kegel, next you need to do the stability component. Whatever, I use the NKT, the muscle testing, to figure out, okay, is the pelvic floor inhibiting the core? So I would do an anti-Kegel and then do some core work afterwards, if that was what my findings were. I hope that helps.
Great. We have another question, which is and she said very helpful. So good, good.
Okay,
Um,
good.
so question, when you had the case study for your um,
Yeah,
patient with the hamstring flexibility, was
yeah.
she asks, are you having him flex the bottom leg while he's doing the passive and active stretch, or is the bottom leg passively on the ground?
So I didn't give any pattern assistance with the cues. Um, because whatever's like patterned into his body is going to show up in the active straight leg raise. So if I just told him, I go, lift your leg high to the sky. I didn't say lift your leg and push down with the other leg. I just said lift your leg. And whatever's patterned in his body is going to come out, right? Um, if I start to give a pattern assistance, so if I start to say lift your leg and push your other leg down, um, then that's starting to create a correction, and it's a verbal cue to change the signal to the brain. So in this case, I'm doing an evaluation. So when he's laying on his back and lifting his leg, because it's an evaluation, I don't want to give any verbal cueing. Um, so I just say, hey, lift your leg high to the sky. Let's see what happens. When when you then teach it like an integrative movement, so if you're having him like then do a crunch while lifting the leg, yeah, you can start to reach the other leg down towards the floor. And in the PowerPoint, the woman's doing it. She's like really flexible, but her bottom leg's coming down. I do start to give that cue to like reach the inner edge, not only of the inner thigh, inner calf, and inner heel down towards the floor. So I will give that cue. But if I'm just doing the evaluation, I just want to see what the person does. Like I want to watch their movement patterns versus trying to influence it with what I say during the evaluation.
Great. Thank you. So another question is, can you discuss the difference in foot placement between Warrior 1 and Warrior 2?
Mm-hmm. Yeah. So in Warrior 2 is actually an easier pose. Warrior 1's a more difficult pose. So in Warrior 2, I like to teach, depending on what you see in the student, so I like to teach front foot is going to line up with the back inner arch. In more traditional yoga, they'll do heel to heel. And then the back foot, depending on the person, the back foot, I like to draw a line from the base of your second toe to the middle of your ankle and make that line parallel to the back edge of the mat. If someone is having a hard time kind of accessing wrapping that back leg, that one that needs more inner spiraling, then I'll have them turn the foot in just a hair. In Warrior 2, in Warrior 1, you teach the back foot at 45, right? Because you're trying to really find in Warrior 1, you're trying to find through these balanced actions a pelvis that is square and facing forward. In Warrior 2, you want the pelvis to open out to the side. So Warrior 2, easier pose, back foot parallel to the edge of the mat. If that's difficult because they're having trouble like hollowing that back leg, finding that inner spiral of the back leg, then I'll have them turn the foot in. If they need to like power up through that back shin, like through that outer edge peroneals and try and lift their arch, then I'll have them keep their foot parallel to the back edge of the mat. Warrior 1, I'll have them turn their back foot about 45 degrees inward.
Okay, great. Um, don't know if anyone has any other questions. Uh, Emily, if you could give your email one more time, just in case anyone does have questions.
Yeah, it's Emily at urbanwellnessclinic.com.
Great. Thank you so much, Dr. Kiberd. Um,
Yeah, thank you.
Great. And we're setting up hopefully some workshops for anyone who's tuned in and curious to learn a little bit more about integrating yoga in a corrective or a functional movement program. And I think what Dr. Kiberd is doing with the SFMA and NKT and integrating the yoga with the primal movements is something very unique. So everybody should stay tuned because there might be some of that coming up soon. All of the webinars, again, are recorded, archived, and coming up in December, I'm going to be talking about kinesiotaping or kinesiology taping in foot and ankle sports medicine setting. So if you do any taping or you're interested in getting involved in taping, specifically in the foot and the ankle, you will want to tune in. Thank you all again, and we will hopefully see you again on another webinar. Take care.
Great. Thank you.
Thanks, Emily.
Yeah, thanks, Em.